We will move on to our last speaker of the day. I'd like to welcome Suzanne Watnick to close us out.
Thanks so much, Kate. I'm gonna get my presentation up here. And while I'm doing that, just want to thank everybody for their patience and excited to talk about something that I've been working a lot on this year. Here we go. Okay. Kate, are we good?
That's good.
Okay, great. So as many of you know, this year I've been spending time in Washington, D.C. with ASN and the Department of Health and Human Services. And one of the main activities has been standing up a Kidney X Prize that we'll talk about at the end to help specifically address this. Also, this is a version of an ASN talk that I'm going to give. So I would really appreciate it if people have feedback either right after or later on how to improve. So just want to start off with a little introductory information. You know, life expectancy has doubled along with the total population, which is approaching, 8 billion, with advances in healthcare, living standards, technology. But at this point, we are accessing 75% of all of our freshwater sources for agriculture. 33% of land has been converted to farmland. And so we know that resource use and emissions are really on the rise. A lot of countries have extremely high water stress, and that demand is actually projected to increase. We need to do better. We know that greenhouse gases are increasing, and the overall temperature has actually raised a full degree Celsius versus pre-industrial levels, as you can see in the bottom right-hand slide. And might be worthwhile to acknowledge that healthcare contributes pretty substantially to emissions. 10% of all US emissions actually rose from healthcare a decade ago, and probably more now. So I want to now focus and talk both about how environment impacts kidney healthcare as well as vice versa. We know that early onset CKD probably is contributed to via heat stress in a number of areas. Associated AKI admissions are increased when we see heat waves and increased mortality in certain areas. We know that nephrolithiasis is on the rise, particularly in places where heat has been an issue. And this costs the US a lot. And if we had good economic analysis globally, which we don't, it would be even more. And we also know that there's an increase in extreme weather events, which leads to issues with regards to access to care in general. However, that's not where we're going to focus today. Today's focus is going to specifically about how kidney healthcare impacts the environment. Globally, at this point, over 3 million people are receiving dialysis. It's estimated that 89% on hemodialysis, which we know uses a disproportionate amount of resources, a lot of water, a lot of energy, and additional waste. Peritoneal dialysis, although one would say, hey, there must be a lot less in terms of overall water use. Well, it's a little unclear in terms of the degree of impact, because the degree of plastics that are used are very expensive in terms of dollars and water liters needed to actually address recycling. So with all of that introduction, by way of today, we're going to talk a little bit more about the carbon footprint of dialysis, demonstrate the environmental impact, then talk about some initiatives that exist really more globally than in the US, and then outline future innovation. I do want to get to the prize that was just announced on September 12th that any of us could apply for to help improve water and power in the dialysis environment. So let's quickly do some math. Think about your facility that might have 3 shifts with 20 stations, and you're running flow rates of your dialysate, not at high rates, kind of the average 600 mils per minute. Look at what that is per year, and you're talking about more than 2.5 million liters per year just going through the machines. It's actually at least double that if you include all of the quote unquote rejected, but still reasonable water that is rejected through the RO. And you can see the calculations for various other quantities. And so the global estimates are that we are using almost 500 billion liters per year of water for dialysis use. Go on to the power issue in terms of kilowatt hours. Again, you can look that we're talking about very large amounts of power. I'll go on to talk about what that is equivalently in households in just a moment. But again, global estimates of a lot, billions of kilowatt hours per year. What does that mean? Well, if you just look at the RO itself, the reverse osmosis machine, 1 day of function is equivalent to a full day of powering 3 households and supplying water for 50 of them. The hemodialysis machine alone, 1 treatment could power 5 refrigerators and could fill a large bathtub. And so let's move on to also talk about greenhouse emissions. We know that the water and energy use are really high, but what about those emissions? So there's actually an interesting look at this within the US in one dialysis organization in the Ohio region. And annually, the average facility was equivalent to almost 100 homes. Each hemodialysis treatment was the equivalent to driving 150 miles in a gas-powered car. And the largest contributors were the use of not just electricity, but also transportation and natural gas. And interestingly, the emissions varied up to 3-fold between facilities, and these were all in the same region in Ohio. I think this is interesting because you can see here that there's high and variable emissions, especially with regards to electricity. The patient and staff transportation was quite high as well, but not quite as variable. And there was substantial, as you might imagine, variation if you look at urban versus rural areas. So dialysis is far from carbon neutral. A lot of consumables. I just listed a bunch of different studies that looked at all of this. When you look at the US study that I just mentioned, that actually didn't take into account a lot of the things that the studies from Australia and Morocco and the UK did. So probably the US treatment was as high as the one from Australia, but they didn't take a number of things into account. And this includes things like landfill, biohazards, and other supplies. So what do we do about that? Let's talk about what we do about that in terms of what the environmental impact might be. We know that we have a global water crisis, and 1/4 of the world population is actually under the highest level, quote unquote, extremely high water stress. I think there's some good pictures here to demonstrate this. Lake Mead has a bathtub ring. This is from just last year. It's substantially lower than it was not so long ago. A dry bed that used to be a lake, as you can see on the right in Lebanon, has also been substantially affected. And globally, it's been estimated that another 8 billion of us are going to be affected in the next 30 years. Global demand for water has doubled in just half a century, and it's going to continue to rise. Same thing goes for power demand. This is a picture. That long white building is a building that used to be farmland. It actually generates power for data. It's a data plant, basically. And so the biggest reasons, as you can see here, economic population growth, heat waves, but also the quote unquote electrification of lives, and the need for that data generation. I think that it's worthwhile to show a chart like this, where we see that although there is an increase in various cleaner uses of power, like solar, wind, and hydropower, the largest sources that are still under use include oil, coal, and natural gas. So with all of that, understanding the environmental impact and how we can do better, let's talk about some potential initiatives that we can think of in terms of the dialysis environment. I'm going to focus first on the in-center hemodialysis environment, or it could be home hemodialysis as well. You see here feed water being cleaned by a sediment filter and carbon, then being pumped into the RO membrane. A bunch of that water is actually rejected, has very high solute concentrations, but it's certainly reasonable, clean water that potentially can be used and eventually goes to the dialysis machine. So let's first talk about feed water, the first of three places we'll talk about in terms of where we can do better. How can we reduce feed water? Can we slow progression, start later, start incrementally, decreasing dialysis flow? And the answers to all of these are potentially yes. We know that we can slow down progression with a lot of newer agents. They are quite expensive, and so we need to do better. There is not currently a screening initiative for the general US population. There are for certain subpopulations, so how can we advocate for that? Starting dialysis later. We have trials like the IDEAL trial from more than a decade ago now, but other cohorts as well that imply that it's okay to wait a little longer than we have in the past. And a current trial that's ongoing looking at whether or not incremental initiation is as reasonable as starting full force. Low flow, more peritoneal dialysis. As I mentioned, manufacturing in terms of plastics and recycling of that potentially is as expensive in terms of liters per water. However, it's felt that that has not been well delineated yet. Okay, back to our schematic. So what about that RO reject water? So that water, how can we reuse unused permeate? Permeate basically is water that has gone through our RO and just has basically a higher conductivity with all of the salts and a few impurities that would not be reasonable to reuse unless you can get it through the system. So it's already filtered and softened water. It actually is within the WHO criteria for potentially potable water. So on one hand, you could purchase more effective systems. And there are some systems that are more expensive, but to recycle in a double stage fashion with the RO, you can actually reuse some of that water. And then there are other initiatives where you can use that rejected RO water for things like janitorial uses. You can retrofit systems and then recoup quite a bit of money and think about various infrastructure of recouping and recycling. And last but not least in our schematic, what about that spent dialysate? That is a lot of water going down the drain. Yes, this has come in contact to blood flow, blood that is flowing in the opposite direction against your semi-permeable membrane, but this is water down the drain. Nonetheless, there are some examples where people have considered recycling spent dialysate. It may meet agricultural standards, and there is one study that actually looked at the amount of organic matter and bacterial counts and how that could be utilized for agricultural purposes. There was high conductivity, which makes sense in this water, but again, that can be improved with a little bit of extra funding in the future. Okay, so knowing all of this, what can we do locally? Some are lower cost issues, lower hanging fruit, and some are higher cost issues. I have a picture of Tammy Heck, who is one of our lead facility services managers who really handles all the water from Northwest Kidney Centers. And she is a huge champion. She is the person that at Northwest Kidney Centers helped to perform environment of care rounds. Identify that champion and think about touring facilities to understand if there are just leaks in the facility. And then, of course, there are higher cost things, equipment with lower water usage. And that is starting to be considered in terms of how to create new machines. Innovative wearables, for example, are also using less water. What are some of the plumbing options that we can do? And what are some of the policies that can spare and save? And of course, this is going to require some investment. And as I mentioned, there is a current prize announced. Tammy actually participated in something called the Meeting of the Minds to help brainstorm about standing up this prize back in February that happened in September. So we can invest in sustainable solutions or not. If not, on the left side, you can see about this circle of water waste and financial loss, lack of awareness, lack of communication, and lack of stewardship. Just increasing awareness can lead to opportunities to reduce, for example, dialysis need or optimizing schedules, reducing water losses. How can we consider priming machines, for example, reusing, as I mentioned, and then recycling? I'm not going to go through all of these, but the bottom line is this slide is here to indicate that there are projects and initiatives ongoing. They do cost money. However, in terms of how it can ultimately save long-term, these are things that are worthwhile bringing attention to and making policy makers aware of so that there can be allocation to pursue some of these initiatives. So in terms of future overarching approaches needed, I mentioned first about the policy attention and that regulators and legislators need to consider updates. Can we limit dialysis needs? What kind of CKD screening can we implement? How can we increase transplantation? And there actually are many policy initiatives right now. It was actually my grand rounds last year talking about the overhaul of the transplant system and the suite of policies that can limit the amount of dialysis needed. Revising policies in terms of conditions for coverage and quality markers to potentially put emissions as a marker of things that we need to monitor. And then working with the federal agencies to improve process and look for other areas of excellence. It would be nice to have some form of collaborative where programs, facilities, organizations commit to actually collecting this data, talking about how they're doing better, how to reduce the variation within their own organization, as I showed you from that study from 2 years ago. Use best practices and think about the commitment to carbon neutrality. Some of the dialysis organizations, specifically one of the LDOs, has said that they're committing to this. They're purchasing offsets, but they're not doing it within the facilities. So that's a good thing to consider. So it's great that we're starting to have people dip the proverbial toes in water to think about what to do. And stakeholders really need to voice questions and concerns to outline the scope and then implement action plans. Don't just do it within the dialysis environment, but pair up with other groups within the healthcare space and bring in climate specialists. There's a whole group, basically it's called OCHI, the Office of Climate Health, within OASH, the Office of the Assistant Secretary of Health, that is currently there. It could be taken away, but at least it's there right now, and they're a good group to partner with. So just talking about future in terms of research and innovation. So there's a lot of stuff we can do in terms of thinking about software and hardware within dialysis machines. We always used to talk about how we had to have a dialysate flow of 50% higher than blood flows, but now some of the hardware in the machine is changing so that hopefully they can match it. Can we, again, put software into the machines where your prime is not required to be quite the same amount as it was in terms of liters and liters? Can revisit some of the older therapies. There's sorbent cartridges, which again would use less water in terms of reverse osmosis machines. Can that be a part of the system in the water rooms in dialysis facilities? We talked about transplant options. And then what are the novel therapies where, wearable devices, for example, that reuse and aren't using 600 mils per minute for a 4-hour treatment? So all of this to say that it would be nice to encourage innovation in this space. And so how can we encourage innovation? Well, we can create competitions. And so I want to talk about this competition that was actually envisioned back about 3+ years ago, but it was only initiated in terms of trying to get it stood up starting in January. And the Kidney X Sustainability Prize is awarding more than $7 million for innovation specifically to reduce water or power used during dialysis, either in the home environment or in center, either one. And this is something that is worth celebrating that we actually got to this step. It really invites proposals for a whole diverse community of innovators not just entrepreneurs, but to partner with engineers, patients, healthcare providers, and thinking about not just technological approaches, but also process improvements. So everyone's encouraged, including any of you listening, to develop these solutions. The launch was on September 12th, and we just had our session by the folks that are putting on the challenge and are going to be helping to stand up the judging, the contractors. That was from the 25th of September, and that was recorded. So if anybody's interested but hasn't had a chance to listen to something like that, you're more than welcome to. It's a short timeline, but again, we're encouraging people to consider applying for this. You also might ask, well, KidneyX, I don't even know what that is. What is that? It's the Kidney Innovation Accelerator. This was a public-private partnership that was stood up between HHS and the American Society of Nephrology, specifically to accelerate innovation, to prevent, diagnose, and treat kidney diseases, and really started back with an MOU almost a decade ago, got started 2018-ish, and was figured prominently in the Advancing American Kidney Health Initiative, announced in 2019 as an area where you could think about innovation to improve the lives of people with kidney diseases. So this sustainability prize is the 7th prize. It is the second largest one. And after this prize will contribute to the almost $25 million that have been awarded through KidneyX initiatives. So this all sounds lovely and the pictures are pretty, but it's not as easy as what I just mentioned. So I thought it was worthwhile to take one slide to help summarize some of all of this work. What have I been doing in DC over the last year, working with HHS to get this going. And it really is a little bit of sausage making for sure. So creating and proposing the idea and then agreeing to pursue, that's before January even came. And that took about 2 to 3 years just to get the various parties to agree that this is an important area to focus on. Gathering internal and external stakeholders, as I mentioned. For example, Tammy Hack was one of the people that we invited. We invited all kinds of folks, patients, dialysis organizations, technical experts, physicians, other care providers to contribute in terms of what was actually important and what was feasible. You create outlines and timelines, gathering subject matter experts above and beyond that for greater granularity. And then once you get your proposal, you have to actually have HHS, and this is the Office of Science and Medicine within the Office of the Assistant Secretary of Health, which is within HHS, to agree to give up that money from their budgetary coffers to use, even though it had already been allocated, and $5 million a year for the past 5 years had specifically been allocated from Congress to do this alongside the $25 million from ASN. So then creating the actual proposal, make sure it's based on evidence that exists. And sometimes when it doesn't exist, you do the best you can to advocate for looking at other fields where it shows that there is evidence that certain ways of potentially improving upon this can happen. Aligning with legal authorities, so to get the government lawyers to agree that your proposal is worthwhile and doesn't have any loopholes that could get them in trouble. Then you need to have the Assistant Secretary of Health sign off, and the actual HHS Secretary, Javier Becerra. That actually took over 8 weeks just to get those 2 signatures. So you do other things in parallel, and you work with your contractors, launch, wait, hold breath. That's what I'm doing right now, along with a number of other people. And then after this, we review. We have a whole group of reviewers, technical panels, actually, then judges, award, and then hopefully watch innovation percolate. All of that to say that, these are important things, and it's worthwhile to take the time. I think I have a video embedded for my next slide. Yes. Oh, it is not. That is unfortunate. Okay, well, this is Admiral Rachel Levine, and Kate, I'm going to try to see if I can play it. If it doesn't, it's a 2-minute video. Not only does it talk about what I just talked about, but it shows you that the federal government is actually paying attention to kidney disease. And I think this is pretty impressive. She's the
I am
Assistant
so
Secretary of
pleased to
Health.
announce the launch of the Kidney X Sustainability Prize, a $7.25 million challenge to drive meaningful change in the environmental sustainability of kidney care. Today's life-sustaining dialysis technology requires billions of liters of water and kilowatt hours of power globally each year. The growing scale of natural disasters, such as hurricanes, tornado outbreaks, and wildfires, are leaving patients without access to critical dialysis care. This puts their very lives at risk. Kidney care solutions that reduce the water and power used during dialysis can improve resiliency during disasters and make ongoing care more sustainable. New solutions may also promote more equitable access to kidney care. Today, more than 15% of American adults, 37 million people, are living with kidney disease and need solutions now. HHS is addressing this urgent need. Since the start of Kidney X in 2018, over $17.5 million in cash prizes have been awarded, focusing on dialysis redesign, innovation in care delivery, and accelerating the development of artificial kidneys. Now, through the Kidney X Sustainability Prize, we're seizing the opportunity to transform outcomes for patients by identifying and supporting solutions to reduce the resource demands of dialysis. We invite you to submit your solution for a chance to win part of the $7.25 million prize pool. To learn more, visit the challenge website at kidneyxsustainabilityprize.com. kidneyxsustainabilityprize.com. Thank you. I am so pleased to announce the launch of the Kidney X Sustainability Challenge.
There we go. So I get excited every time I see that because, again, a lot of work went into getting that script together and having her read that. So just with all of this, I want to acknowledge and say thank you to all of the people with kidney diseases and those supporting them in terms of helping to get this going, the ASN, all of us here. Also, all of the fellows who have been subjected to my love of policy and advocacy over the many years. So thank you. A special shout out, DHHS, all the legislators who care about this, and each of you for your interest, questions, and actions, as well as our group. So with that, I will try to stop sharing. And thank you so much.
Thank you, Suzanne. I suspect just scratching the surface of what's been an amazing year, I imagine, and lots of stories. Questions for Dr. Watnick? I have one question just to start. In thinking about framing this for the government in the context of all the other things that they could be doing to address environmental issues. This would be a more compelling question if I remember the statistics, but I think at some point someone mentioned, the water we use in dialysis relative to, say, fracking is just, not even comparable. But so I wonder about, of course it makes sense for us to take care of our own house. But how do we rank in terms of hanging of fruit for these legislators that you're talking about and making this case for?
Yeah, I love that question. And I want to make the comment that Kidney X in general is a bipartisan, bicameral, well-loved program. And that can't be underestimated. So as everyone probably, knows in terms of fracking, it can divide people who are trying to get things done. However, this is a place where people really have come together. Dollars for Kidney X were actually not in the president's budget for 2025. Rarely do you get dollars allocated when it's not in a president's budget. However, it's such a loved program by Congress. It figured prominently in the congressional budget afterwards with the appropriations and in the Senate as well. So on both the House side and the Senate. And so Kidney X will probably be funded. And so what I would say is, I agree with you, Kate, in looking at some of the numbers in terms of billions and trillions of liters of water per year. It takes more and globally in terms of what's used for fracking. However, let's get some things done. And this is a place where we can get some things done. And I think that has been a good lesson for me in this year so far, that it's important to aim efforts to places where we can actually get things done for the betterment from a policy perspective. But thanks for that question.
Some appreciation for your work in the chat.
Oh, thank you. Thanks everybody for supporting me. Hand it back to you, Kate.
Well, I certainly hope I will send you an email. I have more questions. But thank you for that presentation. Thanks everyone for 3 great presentations across the spectrum today, and hope everyone has a great weekend. Bye now.